Welcome everybody to my poster presentation. My name is Vicente Artola Arita and I belong to Prominent Project 4.4. Is atrial fibrillation a mechanism or a bystander in heart failure? The role of risk-personalized factor management. As a background for my project, heart failure with preserved ejection fraction is a disease in the heart in which the heart cannot project all the blood to the system, making it insufficient to work. Atrial fibrillation, on the other side, is an electrical problem that progresses and creates remodeling, making at the end the heart not to perform its function. Even though these definitions are pretty clear, when identifying patients with either of the conditions, we see that they have related symptoms. Also, when performing analysis, we see that the measurements are similar in both entities. So in clinical practice, it's really difficult to distinguish between these two entities and makes the picture a little bit blurry. Within my project, I intend to identify patients with either of these two conditions or both combined by analyzing patients who have been diagnosed with heart failure with preserved ejection fraction, patients with atrial fibrillation, or both combined, analyzing them in depth to really characterize what really is a patient with heart failure with preserved ejection fraction, a patient with atrial fibrillation, or a patient with both conditions. How do I tend to do that? We are currently analyzing and characterizing patients from clinical databases that may have either of these conditions or both combined, and we're also performing different analyses including imaging and blood biomarker analysis to identify which pathophysiological pathways can be related or can trigger any of these conditions. In the future, we intend to validate this clinical characteristic in future databases, also including analysis of biomarkers. We intend to create collaborations to prove our models into mice models and also verify how much percentage of our model can be explained by genetics to really identify these people who can benefit from an accurate diagnosis, for an accurate management of personalized medicine and treatment. As a result, I intend to clarify the picture for patients with either of these entities or both combined. Thank you very much for your attention.